an inner cannula that has to be cleaned, okay? We don't see these a lot anymore. Most of our trachs are going to be the inner cannulas that are disposable. So when you remove this inner cannula, you just throw it away and put you a new one in, okay? If you are cleaning one that has an inner cannula like this, then you're going to have to clean it, okay? And we have two different kits that are actually used when cleaning a trach. You either have one that's gonna clean the one with the inner cannula that is not disposable, and you have a different kit that you clean with the inner cannula that is disposable, okay? I'm gonna show you that. What you will be using, and for today for practice as well as for checkoff, we have these sterile packs that we've placed the inner cannula in so that you get the feel of opening up the brand new inner cannula and being able to use it rather than having to pretend like you're getting a sterile one, okay? This is a sterile inner cannula, so to speak, okay? I'm gonna put this back in here, just so it'll be there when I'm ready for it. Okay, one of the things that I want to show you too, this is a kit that you might see in the hospital setting, and it has the, I can't say the word real well, the perpetrator, or it has it in there with it. It has the actual trach, and then this one is one that doesn't have a removable inner cannula. It does not look like, but this is what the kits would come as. You would get one of these kits. You'd have, if your surgeon was putting in a tracheostomy on the floor, or you had to have an emergency tracheostomy kit sitting ready to go, just in case that patient come back from having their parathyroids removed and you got swelling going on around the trach, then you would want to have your trach itself, that kit, as well as the sterile trach kit, tracheostomy kit that is all sterile, and this has got everything the surgeon needs to insert a tracheostomy in. So you have one of these and that tray, okay? This is an ET tube, in case you've never seen one of those. I'll pass it around, let you look at it. But this is what actually, when we put in somebody on a ventilator in an emergent situation, they're using an ET tube, which actually goes down the trach and is left in place through the mouth down the trach. And so I'll let y'all look at that as well. And any of this other that you want to look at, you're welcome to. I do want to show you the two different types of kits that we use to clean the tracheostomy. The first one is the one that you would have to take the cannula out and put it into solution to clean it, and then it would be put back in. You see, it is, both kits come with sterile gloves. So here's our sterile gloves on top. Note the difference here with the one we're actually going to be using. It is one compartment. This one has 3 compartments, okay? You have a sterile drape that you can set up your sterile field on. You have what looks like a bottle brush, okay, for lack of a better word. And you have Q-tips, and you have pipe cleaners, okay? Just so that you know, if I've got this in my solution, if I've removed it, have it locked, you can't get it out. What I would want to do is put it in the largest compartment. So I would set everything up sterilely, okay, and this would go in my larger compartment. It would have half-strength saline and peroxide in it. So you would put, I should say half-strength peroxide. So you put your peroxide in, and then you would pour saline in on top of that, and that would be used to clean your inner cannula. Now, again, all this would be set up sterilely. But to clean it, you would go in like that, just like you would a bottle, and come back out. Now, if I'm doing this sterilely, I'm gonna only hold the hub of the inner cannula, which is this part, okay? These things do twist, so they can also be kind of crazy. My sterile gloves would be on, and this hand would be contaminated